Yes, this is Preeti and you're watching my resolution. In this video, I'll be teaching you subscapular space or intermuscular space, which is a RS question, reverse reverse question, RS2 question, and it has been asked as for 5 marks short essay. Subscapular means below the scapula. There will be spaces below the scapula. If we reflect the posterior part of the deltoid, we see these spaces, and they're also known as intermuscular spaces, as these spaces will be in between the muscles. So this is a quadrangular space, and these two are triangular space. There are 3 spaces, one quadrangular, 2 triangular space. These are in between the spaces, so they are called as intermuscular spaces. One quadrangular space and 2 triangular space. One quadrangular space, 2 triangular space. We need to write the boundaries of these 3 triangles and the content of those 2 triangles that are piercing those spaces, that are crossing those spaces. Quadrangular. First, we speak about the quadrangular space. Superiorly we have teres minor. Inferiorly we have teres major. Superiorly teres. This is a quadrangular space. Superiorly teres minor. Inferiorly teres major. Medially we have long head of triceps. Laterally we have surgical neck of humerus. Surgical neck of humerus where axillary nerve wound surround it. So now quadrangular spaces boundaries will be superiorly teres minor, inferiorly teres major, medially long head of triceps, and laterally will be the surgical neck of humerus. See, superiorly we have teres minor posteriorly, and anteriorly below the scapula subscapularis muscle will be there. This is not shown in this image. So superiorly teres minor, posteriorly anteriorly subscapularis. In between those two, there is a capsule between capsule of the shoulder joint in between these 2 muscles. And inferiorly I said teres major. Medially long head of triceps. Laterally there is surgical neck of humerus. So you got the contents of quadrangular space. Now the structures passing through this quadrangular space. Here it comes. You know that axillary. This is a surgical neck of humerus is a boundary of quadrangular space. So structures related to surgical neck are also the content of quadrangular space. Axillary now posterior circumflex humeral artery and vessels. Anterior will be the anterior side. So this passes posterior circumflex humeral artery. As we are seeing from the back, we can see only posterior circumflex humeral artery. So the contents will be axillary nerve and posterior circumflex humeral artery and vein vessels. And upper triangular space. Upper triangular space is this. This is the upper triangular space. We can see the boundaries superiorly, inferiorly, and laterally. Superiorly by the teres minor and inferiorly teres major. Laterally by long head of triceps. Superior, inferior, and lateral. Superiorly teres minor, inferiorly teres major, laterally by long head of triceps. And structures passing will be circumflex scapular artery. It surrounds the scapula. It arises from the third part of the axillary artery and surrounds the scapula. So this is circumflex scapular artery is a content of upper triangle. And now we go for the lower triangular. Boundaries of lower triangular. This is a lower triangular space. This is lower triangular space. Medial, lateral, and superior. Superiorly teres major. Medially long head of triceps. Laterally shaft of the humerus. Medially long head of triceps. Laterally shaft of humerus. Superiorly teres major. And the content will be radial nerve and profunda brachial artery. As you know that radial nerve will be present in the spiral groove or radial groove on the shaft of the posterior aspect of the shaft of the humerus. So this is a radial nerve in the spiral groove, and profunda brachial artery, which is a branch of brachial artery that goes posteriorly and supplies the posterior part of this forearm, this arm. So profunda brachial artery is and radial nerve are the contents of lower triangular space. Structures passing in the lower triangular space will be radial nerve and profunda brachial artery. So once again I will revise in this. There will be 3 spaces. These are also known as intermuscular spaces or subscapular spaces because they are present below the scapula. These are one quadrangular space, 2 triangular space, one upper triangular, one lower triangular space. Boundaries of upper quadrangular space will be superiorly teres minor, inferiorly by teres major, medially by long head of triceps, lateral surgical neck of humerus. And boundaries of the content which is present in the upper triangular space will be axillary nerve. This is axillary nerve surrounding the surgical neck of humerus and posterior circumflex humeral artery. and upper triangular space, the content of the boundaries of the upper triangular space will be superiorly teres minor, inferiorly teres major, laterally by the long head of triceps, long head of triceps, and the content will be circumflex scapular now, so scapular artery, which is a branch of axillary artery, third part of axillary artery, and the boundaries of third space will be that is lower triangular space will be superiorly by the teres major, medially by the long head of triceps, laterally by the shaft of the humerus, and the contents will be there will be a spiral groove here, over here on the shaft of the humerus. In the spiral groove there will be radial nerve and the profunda brachial artery, which is a branch of profunda brachial artery, which is a branch of the brachial artery. These are the boundaries and the content of quadrangular spaces. If you like my video, stay tuned for the continuous video. If you think that these videos are helpful, stay tuned. Thank you.